Hi everyone. It's very common people suffer from anxiety. Tell me this. What is recovery bump? How long do they usually last? And what caused them? It's very common people during the treatment of anxiety receive more and more symptoms. Some people say, I've been doing really well with my recovery and have been experiencing a significant amount of symptoms reduction over the last 3 months. But about 3 weeks ago, I experienced what I thought was a bump where my symptoms elevated again and have persisted ever since. I've even seen the return of some symptoms that I haven't had in a very long time. Can bumps last 3 or more weeks, or has something else occurred that has caused a return of my symptoms in feeling poorly? It's very common, this kind of question. When you are faithfully practicing your recovery strategies, we use the term recovery bump to describe an episode of feeling worse, elevate sensations and symptoms. After a period of feeling better, a reduction of the or elimination of sensation and symptoms. For example, because of your faithful recovery practicing effort, you feel much better, but not for no apparent reason, you suddenly feel worse again. This is what we refer to as a recovery bump or the bumps. Typically, recovery bumps can last anywhere from a few moments to weeks or more. And while a bump period can last for 2 weeks, these are the exceptions and not the rule. The majority of recovery bumps reside within a week or less. There are three main reasons with recovery bump periods occur. First one is stress. Any type of stress can further stimulate or already hyperstimulate the body, which can cause increasing anxiety sensation and symptoms. Demand physical activities such as long hours of work, rushing around, rigorous physical workouts, and prolonged mental exertion can increase stress and overall body stimulation. And increasing stress and stimulation can also be caused by a persistent hot temperature, disrupted sleep, infection, flu or illness, and acute and chronic pain, to name a few. An increase of stress stimulation can experience high stress due to psychological and emotional reasons such as excitement, worry, fear, grief, anger, depression, impatience, frustration, resentment, irritability, to name a few. An increase in stress can cause a return of symptoms of stress. A chronic stress can also cause a return of persistent sensation and symptoms too. Number two, unidentified, undressed underlying factors. The underlying factors of anxiety, the behaviors, thoughts, or action situations and circumstances that motivate apprehensive behavior are often invisible to the sufferer. Consequently, they can cause invisible stress that we aren't aware of minimize, which can aggravate hyperstimulate too. For example, if someone who is in a health relationship may think she's doing fine, but the stress comes from the unhealthy relationship can cause frequent bumping periods. Another example is someone who is people pleasure may not be aware of their dead address people pleasing behavior cause. It's very common and people suffer a lot of that about that. Number three, as long as the body is hyperstimulated, it can be misbehaved. Hyperstimulation can cause the body to act erratically. Erratic behavior can cause sensations and symptoms to appear for not apparent reason. For example, the body has thousands of monitoring and regulated systems all working together to keep the body functioning. To remain healthy, the body must be regulated and maintained in ongoing state of internal balance despite the ever-changing conditions. Homeostasis is the term used to describe this ongoing process. The body has many systems that regulate and monitor the body's function to accomplish homeostasis. These systems automatically sense an imbalance. They engage the appropriate system to take action when necessary. This corrective action is intended to return the body to its health balance. The body, when allowed to function normally, would last a lifetime in good health. A healthy body resists disease, adapts, and repairs itself despite injury or stress. For the most part, the body functions as constructed all by itself. When the body is healthy and not hyperstimulated, it performs these multitudes of moment by moment checks and automatic balances seamlessly and visibly. Therefore, we go about our daily activities feeling normal and while being utterly unaware of the body's automatic homeostasis actions that are automatically keeping our system working normally. However, when the body becomes hyperstimulated, these automatic checks and balances can encounter problems as the body works to establish what it thinks as normal baseline. These problems can cause erratic levels adjustments. So it's common in this case, these errors can cause numerous sensations and symptoms, and so much so that you can feel as if you are starting your recovery all over again or worse. Hyperstimulate Stimulation can cause numerous homeostasis anomalies, which can result in the body behaving abnormally. And for no apparent reason, we refer to these homeostasis anomalies as recovery bumps. We refer to this erratic homeostatic process as homeostatic dysregulation, also referred as the homeostasis or cacostasis. You can read more about this in a lot of articles or scientific articles. Furthermore, these bump episodes can last a moment or two, or for a week or more, depending on how long it takes for the body to settle down. Other factors cause this return of the symptoms associated with anxiety. Medication is very common side collateral effects in medication. Recreational drugs, stimulants, sleep deprivation, fatigue, hyper or hyperventilation, low blood sugar, nutritional deficiency, dehydration, hormone changes. So recovery bumps can be caused by any one, two, three, or all four of the above reasons. Consequently, sometimes it might be difficult to discern with combination of reasons is caused by bumping episodes. However, more often than not, if you are faithfully practicing your recovery strategies, keeping your stress to a minimum, containing your anxiousness, and working at your underlying factors, the bump period is caused by the involuntary actions of the body. In this case, there is nothing you can do about it but passively accepting the bumpy episode and write it out. Take care of yourself, breathing, practice meditation, doing a psychotherapy with a good specialist with anxiety, and you will feel much better during long periods of time. Okay? Thank you for watching me and subscribing my channel. Thank you very much.